anxiety presentation. My name is Dr. Alexa Bagnall, and I'm a psychiatrist here at the IWK Hospital. And I've actually been part of the anxiety group since it started, and that was when 2005. So 12 years that we've been doing groups here for anxiety and running this education program. And we have decided to now put this on video so that we can make it more accessible to families. So what I'm hoping is that we'll cover this in about an hour, hour and a half, and then have lots of time for questions at the end. So first, I'll always start with what is anxiety, and it gets a whole bunch of names by kids, parents, and teachers alike. So some people call it fear, some people call it anxiety. Most kids, when you say anxiety, they don't actually know what you mean. And many kids relate to the word worry as a common way, but fears too, what they're scared of. So we talk about those three terms, and we talk about how normal anxiety is. And that's one of the most important things I think we do when we actually teach kids about anxiety and then how to cope with it and how to help kids so that anxiety is something they can manage and not be the boss of them, is that everyone has anxiety. In fact, if you don't have any anxiety, things are not so good. They're not so good for you because anxiety keeps you safe. It helps with making good decisions. You just don't want anxiety to be the boss of you. You want to be the boss of your anxiety. So we always talk about everyone worries, everyone gets anxious about things, but it's how you manage it that's really important. And we give examples like very young kids will be afraid of things. They might be afraid of monsters in their room or strangers. And as you get older, you would expect to grow out of those kind of fears. It's often common for people to be afraid of insects and different types of animals. And it's really how do those fears affect your life, not whether you actually have them, because we all have certain things that we're not so keen on. For instance, I am really not keen on snakes. Very, very unkeen on snakes. My children all know that I am unkeen on snakes, and we have a cottage where there's tons of snakes, of course. We picked it like a snake den where our cottage is. I've had snakes put in various places, and my reactions have actually led to so much distress in our house that I no longer get any exposures to snakes by my kids because I really don't manage snakes well. But I'm able to go outside, do other things, but do not put a snake near me, touching my skin, or even really close where they might actually move very fast and get close to me. We know that there's also normal worries that happen as you develop, and that people who have kids in junior high and high school know that social worries become more of an issue. Not that they don't happen in elementary school, because definitely kids are impacted by social situations in elementary school, but you become more aware of your peers and your peers' opinion, and fitting in with your peers becomes more important in junior high and high school. And so that social worry will often become more prominent at that time. And adults, the most common fear, I've already got put out there, is actually around public speaking. What we're doing right now. So that's actually the most common fear in adults. And that would be what we consider a very regular, normal worry. But if it got in the way where it was actually impacting someone's job or making it impossible for them to actually go and do some of the things they're expected to do, then we might actually need to sort of help in other ways in terms of managing that fear. So we talk about when anxiety is a problem. So it's normal, it's part of development, it keeps you safe at times, it helps you make good decisions. But if it starts to make decisions for you and keeps you from doing things you need to do or should be doing in terms of your developmental stage, such as like going to school, spending time with friends, doing things with your family, trying new things, feeling confident about things and good about yourself, if it starts to get in the way of that, then we start to think, well, anxiety might be causing a problem. Your worries might be getting in the way for you. And we know when it's helping you make good decisions, like remembering to wear your seatbelt as adults. Sometimes we're worried about actually getting a ticket and not so motivated by we could actually get in an accident and get hurt, but we do make decisions based on actual things like rules and worries around getting a ticket. So you can make a good decision around wearing a seatbelt, also being cautious around like looking both ways before you cross the street. And those kind of things that we actually, studying for a test would be an example, but say you actually study for hours and hours and hours for a test to the point where you can't sleep, then it might be interfering. So we don't want people to say, oh, I have no worries at all, I don't even care about that test. Well, that's going to cause problems because you're not going to do very well on the test for most people, or eventually that will catch up with you. So we want people to have some anxiety and worry where they actually prepare. And I always say, if you want to really see people who don't have any anxiety or not enough anxiety, YouTube is a perfect place to search that out. So YouTube videos, if anyone spends any time looking at, is full of people who videotape themselves, their friends, doing things with not enough anxiety, fear, and making not so, what I would say, not awesome decisions, not great decisions. So that is a great place. One of my favorite stories is around the squirrel jumpers. I don't know if anyone's ever, you're all going to go home tonight and YouTube that. So the squirrel jumpers jump off cliffs in squirrel suits, because that sounds like a reasonable, good decision to do. These squirrel suits have absolutely no, they're homemade. They fly with their arms. They have some material. They actually do get some, if upward mobility on some of the currents, but their outcomes are not awesome, not great. Usually those genes, the squirrel jumper genes, they don't make it to the next generation. They generally get lost in this generation. But anyway, YouTube, I highly recommend in terms of looking at if you want to see. So I always say, we don't want to get rid of all your anxiety, because it actually is a helpful thing, and it helps you be successful, and many successful people have anxiety that they manage well. So we also talk about when do we think it caused a problem, when it's getting in the way of your function or causing too much distress either for you or for your family. And usually with kids and adolescents, it affects everyone in the home when anxiety is a problem. So most of you would probably be well aware of that. So here's just some examples of anxiety where it might actually get in the way. So needing all the lights on one floor when you go to bed. So being very afraid to sleep in the dark. For some kids that can be really challenging, but it can also affect everyone in the house because the lights are bright, and it's actually very hard to fall asleep with bright lights for most people. Being afraid of something happening to you or your parent or your caregiver when you're separated. And so doing anything you can to prevent that separation, or becoming very, very distressed if you are separated. And that's a very common younger kid type of anxiety. Not being able to try new things, so really worried about trying new things. And that can be for different reasons. Change, some kids have a lot of worries around change. It can be fear of failure or not being able to do it well. And it can be also social fears in trying something new, in being worried about meeting someone new or not knowing the people that are doing it and feeling very anxious about that. Not being able to speak in front of a class and actually avoiding school because of that. So it's one thing to be quite anxious and not like presentations. It's another thing to miss the whole day on the day of a presentation. So those are all some examples. There are many examples of anxiety, and we're going to get into some of the types of anxiety in a little bit. So when we talk about treatment of anxiety, we talk about three main components. There's how you feel, and that's like the anxious, how you feel physically. How you think, and we often think of those as worries, so the worried thoughts, and how you act, so how you behave when you're anxious. And when we talk about treatment, the type of treatment we use in therapy is called cognitive behavioral therapy, which is really just a fancy name for changing how you think and how you act in a situation, which then leads to change how you feel. And the science behind that is you cannot tell someone how to feel. Or you can do it till you're blue in the face, but it will make absolutely no difference. So if you tell someone to be happy who is unhappy, they will just be annoyed at you. Because you can't make someone happy by telling them to be happy, or tell them all the reasons they should be happy when they're unhappy. They need to be able to do that themselves, and it's things of how they're thinking and how they're acting that will make a difference. That is the same for anxiety. So anyone who's tried to tell someone not to worry about something, it may work for like a millisecond, but you will need to tell them again and again and again not to worry, because you can't actually change how someone feels by telling them just to, don't worry about that, you shouldn't be worried about that, or that shouldn't be something you're scared of. You need to change how they think in that situation and how they act, and that will lead to a change in how they feel. So that's cognitive behavioral therapy in a nutshell, and that's the skills we train kids and teens in, and we also train parents in terms of coaching them. And they're skills that I use all the time, and there are also skills that when I don't use them, I realize I should have used them. So there's a lot of it that you'll say, oh, that makes total sense when you're thinking about different situations. So when you think about the physiological, I call it the physical component of anxiety, Some kids are really physical in terms of their manifestations of any emotion, but we'll stick with anxiety. So they might actually not know they're worried or fearful, but they might report to you like frequent headaches, stomach aches, not feeling right in their body, restless, heart racing, feeling dizzy, lightheaded, or just saying, I don't feel well. But you know that they're actually not ill, they don't have a fever, they're not vomiting profusely, but that's sometimes how anxiety manifests in kids, and they might not even know that they're actually worried or fearful of something. So the physical component is really important to know, because there are kids that worry, know they're worried and get physical symptoms, but some just get physical symptoms. And when we look at it in terms of how, I'm going to talk about the brain in a little bit and how the neurochemicals transmit the messages to the body, but you can see that anxiety can affect any part of the body. So a lot of people think of anxiety as they might know what's happening in the brain, but they don't understand that the brain sends messages to all parts of the body. So you can actually have a stomach ache and be worried about something. You can have your heart racing, be worried about something. You can feel short of breath, be worried about something. And these things can be indicators, and we want kids to start to realize how their body's telling them things, so that we can help them say, okay, that's actually your anxiety, and these are the strategies, instead of, you're right, you're sick, you should stay home and in bed, which then doesn't lead them to be able to identify that it's anxiety and how to cope with it. So this is the biggest part of the talk, and there's a quiz at the end with correct spelling of all these things. Just kidding, there's no quiz at the end, and no one can really spell these things, including me when I'm actually put it to a test. But it's very important to think of the brain when you think of anxiety, and the reason it is because anxiety can be incredibly frustrating, because it can look like kind of willful behavior or not oppositional behavior, really tough behavior at times, tantrums, high distress, and it can be very frustrating because it can sometimes be over something that you feel is quite simple or they should be able to do, or it can be really interfering in your family and you're exhausted. But to bring it back to the brain, anxiety happens in the brain. So it is not something that is made up. It is actually a brain signal, and the brain's kind of mis-signaling around a situation for the kid. But when your brain takes over, especially in a high-intensity situation, your ability to reason with your brain, or anyone else to reason with your brain, doesn't have as good a chance. So we want to work on strategies before your brain gets escalated. So just to tell you how the brain works, there's the limbic system, which is the oldest part of our brain. It's our emotional core. It brings all of the sensory information, comes into our brain and into the thalamus, which is part of the limbic system. And it actually, our sensory information is what actually translates into whether we are fearful in a situation, because we get all of our information from our senses. And everyone responds differently to sensory information. Some kids and teens are more, I guess, susceptible to different sensory stimuli or different information. And this connects to our memory too, and our past experiences. And because everyone's past experiences are different, everyone will have different responses. So this is to give you empathy in these situations when it can be frustrating, because your brain is what's responding to these things. It's taking information from outside. And if it has a high response, a high anxiety response to this information, it can go into fight-flight. And fight-flight is an incredibly important response. It's set off by our amygdala in our brain. I don't even know if I spelled that on here, but it is part of the limbic system. And that fight-flight response is actually there for a good reason. It's our survival response. The problem is in anxiety, it gets triggered when we're not in a survival situation. And we need to learn to regulate that if we have it, so that it down-regulates. Because when we're in fight-flight, that's all our brain will do. It will not do anything reasonable. It will either freeze or flee. It will get highly distressed, but it will not think rationally at those times. One of the important things to manage our fight-flight is our prefrontal cortex, which I call the CEO of our brain, the very front. It helps in decision-making, realizing if this is actually rational. It helps with impulse control, and it helps with regulating our emotions. So it's really important that we activate that. Unfortunately for kids, the way our brain develops is back to front, and the last part to fully develop is the front. And it doesn't really fully develop till we're about 25. I will say that there's some adults that might not be fully developed in even at 25 or later, but that is the way it develops. So often kids do not have as good prefrontal fine-tuning, so they are more emotionally labile, and so they will have responses without being able to dampen them down as quickly. The locus coeruleus is the alarm system in our brain set off by the fright flight, and that's what sends noradrenaline and activates our sympathetic nervous system in our brain when we are in fright flight. So this next is just talking about what the fright flight response and how it feels in the body of a person having it. And so one way to think about it is from your own personal experience. If you are in a situation where you've almost had something happen, so you've maybe been in a crosswalk and someone comes close to you, you're on a bike and someone nicks you, so something really close to an accident happens, or you just get you just slam on the brakes and miss something. Those situations, you can think of what happens physically in your body. Heart races, you feel, and it actually takes a while for that to calm back down. So that fright flight is actually what we use to kind of get ready in that situation, and it takes a while to calm down. If you're pumped up all the time, you can imagine how exhausting that would be. And eventually, it actually gets to the point where you're feeling exhausted by it and you can't actually sort of maintain, and you kind of get tired. And kids with a lot of anxiety will often complain that they're quite tired and fatigued and have more trouble with sort of going through their full day, because it is quite exhausting to have those episodes. So this is the fright flight in a picture format. So what happens when your sympathetic nervous system gets activated with your pupils, your mouth getting dry, all of the blood rushes to like your heart and making sure your heart's going, you're breathing because you're supposed to be able to flee. Your cognitive brain is not getting as much blood in terms of thinking, and your stomach gets activated. So you have a lot of physical symptoms with it, but most what kids will report is like heart racing, feeling dizzy and lightheaded, can't catch their breath, hyperventilating, feeling like sometimes they feel separated from their body or not part of their body, or things aren't real, and it's incredibly scary when they don't know what it is. And one of the things we help them with is this is anxiety. There's nothing really serious going on in your body right now, because if you think something's really serious and you don't understand it, it actually escalates the response. So we talk about when is it anxiety versus sort of regular worries, when is it actually getting in the way? And anxiety is often when there's a perceived danger or an overreaction to danger. So an example would be, I shouldn't say, I don't know if there's any dentists in the audience, but most people don't love going to the dentist. It's not like their favorite activity, but they kind of endure it because they know that oral health is really important and taking care of your teeth is really important. But some people have a very extreme reaction to dentists, and it's not that the dentist is necessarily dangerous, because there's nothing dangerous that's going to happen, but there's a perceived danger, and they can have a full panic attack, fright flight response in thinking about, and we have kids who are so anxious about going to the dentist, they actually need to be put to sleep to actually have their mouth examined. So that would be an extreme fright flight response to a situation that might not be the favorite, but isn't a real dangerous situation. Another example would be a lot of anxiety around going to school in a situation where school is quite safe, so things are going well at school. So we're not talking about a situation where someone has been really severely bullied and it hasn't been a safe place, but a place where school might be somewhat stressful. There's some dynamics going on with school, or one of the subjects is challenging, but school is overall a safe place. They have some good friends there. There's support from the teachers, but they start to get more anxious about school and not feeling like they can go and feeling sick on school days. So the brain and anxiety starts to perceive the school as a dangerous place, or that's what it's telling the brain. But in truth, it isn't. So it's not a reality-based perception, but it gets in the way. And these are some other examples of times where it shouldn't be dangerous to sleep in your own bed or being alone in the house at the appropriate age. We're not talking about 3-year-olds, we're talking about 14, 15, being able to spend a bit of time on their own in the home, waiting for someone to come back. Using a public restroom, do I think they're the cleanest things in the world? No, I don't, but we should be able to use them when we're out and use them safely in terms of making sure we wash our hands afterwards. Being able to order food for yourself in a restaurant can be very hard for some kids, but really hard to hear your voice out loud, thinking that you're going to say something wrong, thinking that they're going to think you're an idiot, and actually not being able to do it. Going on a sleepover at an appropriate age, going to a party, worries about having your heart race, so you actually become hyper in tune with all parts of your body. So if your heart even increases a little bit, that can trigger actually a cascade where you become into fight flight because you think, oh my gosh, it's happening, and then it actually does happen because your brain signals it's a fight flight situation. And then worries about falling asleep and not waking up, worries about the future, all those things that shouldn't be really dangerous but become dangerous in an anxious brain. So I'm going to talk a little bit about the components cognitive behavioral, just so you can kind of have an overview. And these are some anxious thoughts that a kid might have, and we talk a lot in the therapy about what kind of anxious thoughts might you have and how might you cope with them or fight them or change them so that they're more helpful and less anxious and worried. So anxious thoughts tend to catastrophize. They tend to be one way and not able to see sort of other alternatives. And they're usually extreme. So one of my favorites with social anxiety, which is a common anxiety disorder in teens, is around presentations. And teens will talk about the presentation and they can't do it because everyone's going to think they're an idiot, they don't know what they're talking about, they're going to remember the mistakes they made. So then you will have them say, well, how many presentations were there today in class? Because they usually do them in groups. There were 4. What were the presentations about? Just name, actually just one presentation. What was it about? Oh, I don't know. I don't know what it was about. I'm like, okay, name one mistake someone made today. Well, I think there was the slide didn't move, or, and I'm like, okay, so was there anything funny that happened? They can name maybe one thing. I said, so you don't remember what any of the presentations were about. You can't really remember anything significant about it. So it's and trying to get them to see that their brain is actually going to this extreme, but actually, in reality, they don't remember anything of anyone's today. So what would make it any different for someone watching them the next day? Very discouraging for teachers to hear when they find out that actually they don't pay attention to any of the presentations that anyone does, and they don't remember any of the topics. But encouraging for social anxiety when you realize that actually people don't pay attention at all and that they're not going to probably remember that. And those are the kind of things we try and get them to challenge. But some of the things just in this list, the safety stuff that happens often with generalized anxiety disorder, so a lot of worries about something bad happening, someone breaking in, or safety related things and needing to check the locks and doors and then check them again. And then the last one is just around the panic attacks, so any symptoms in your body and over-responding to them or becoming hyper-attuned to any changes in your body. So all those things are part of the cognitive that we will challenge. And then there's the behavioral, and generally with anxious behaviors, they're avoidant or very high distress, and they also often seek a lot of reassurance that things will be okay. Kids and teens do. So avoidance is an awesome strategy in the very short term. Because if you think of anything you're anxious about or worried about or really don't want to do, you can avoid it for a little bit, and that works. But eventually, we all know as adults, that does come around, and it doesn't become a long-term great strategy. And with anxiety, the avoidance actually has not only the accumulative that you haven't done what you need to do, but also it actually makes anxiety worse. Because you lose confidence you can handle that situation, and it fulfills your sort of already worried thought that you actually can't handle that situation that is an anxious, dangerous situation. So one of the things we know is that avoidance is a very strong coping strategy for anxiety, but we really need kids and teens to challenge it in order for the anxiety to get better and for them to face their fears. And when you hear face your fears, that's usually what we're talking about, is to face what they're afraid of and not avoid it, and then use their strategies to cope with it so they realize actually they can handle it. And you as parents end up being the coaches and the cheerleaders to help them not avoid it. The other way they engage, that anxious kids engage families, is by looking for a lot of reassurance. So they want to make sure that things aren't going to happen, or that the worry isn't real, or that things are going to be okay, and so they ask for reassurance. And you can usually tell if it's reassurance seeking because it's not usually just once. They ask it again and again and again. And one thing with reassurance that is for sure with anxiety is it's never enough. So you can never give enough reassurance to make anxiety go away. You can sort of allay it for a little bit, but it will come back, and it will come back stronger, because the only person managing the anxiety in that situation is the person giving the reassurance. The person asking for it is not managing any of their anxiety. They're just dumping it on the other person and getting them to cope with it, tell them things will be okay, but they haven't learned anything within their own brain to manage and self-regulate that. One of the things that parents will say when they get pushed around anxiety is they're pushed to the point where they're actually saying things that aren't realistic. So an example of that would be the what ifs. We call them the what ifs because, when will you pick me up? Well, I'll be at school at around 3:30. Well, what if you don't make it for 3:30? What if you're in a car accident? Well, I'm not going to get in a car accident. Well, what if you did? Well, I would call you, I'd call the school and I'd let them know. Well, what if you're unconscious? And, well, I wear a seatbelt and I don't drive fast, so it's very unlikely that I'm getting in an accident and be unconscious. And you get yourselves into these traps of like going through this, but well, what if you're dead? I'm like, well, and then the parent goes, I'm not gonna die. Like, so they get to the point where they're actually saying something that, first of all, probably isn't realistic in terms of overall, like, so parents will say, I will never die. I've had parents say, I've said that. I said, well, I took away Christmas, so, I don't know. Like, we all do things where we're probably not gonna, but the what ifs do push you to the point where you're actually saying things that aren't very realistic, and yeah, they actually know that. So it is important to kind of know when you're getting into reassurance and to be able to think of ways that you can actually, and we're going to talk about ways you can manage that without getting into a reassurance cycle where they actually are managing their own anxiety and you're not managing it for them. So the anxiety, the reason that that we have the education sessions, and we have been doing this for a lot, is anxiety is actually the most common mental health problem in kids. We see kids with other problems more commonly, often, especially teens with anxiety. They tend to not want to come and talk to us about their anxiety, mostly because social anxiety is one of the most common, and the last thing they want to do is come and meet a stranger and talk about how anxious they are about meeting strangers, which usually doesn't work. So, or you tell them, guess what, you're going to come and talk about your fears and maybe meet some other kids with fears, and they're like, have you listened to anything I've said? Like, that sounds the most ridiculous plan I've ever heard of. So social anxiety often keeps kids from seeking help, and anxiety often becomes quiet for some kids, so they don't actually seek help, or parents don't realize with the physical symptoms that it's actually anxiety that's driving it. So we see kids with behavioral problems and attention problems and other problems often more frequently than anxiety, but I will say that over the last decade, a lot more awareness around anxiety, both at schools, in the community, and in mental health, and that has really helped to bring awareness of this very common thing that is very treatable, and that's the great thing. The cognitive behavioral therapy really works. We have excellent evidence. It's probably one of the most studied areas in child and youth mental health, and the cognitive behavioral therapy is incredibly effective. Some kids do need medication as well as cognitive behavioral therapy, but many just need the therapy, especially in the mild to moderate. There are kids in the moderate to severe or who might develop other illnesses as well as anxiety that may need medication as well. But it is a really rewarding area to treat because we can see kids and teens do a ton better with this treatment and gain a lot of confidence and belief in themselves. And really, the reason that any of you are seeking help for your kids is because anxiety takes away confidence and feeling good about themselves, and it causes a lot of distress. And we want kids to feel good about themselves and to have things they feel good about and that they believe they can handle situations. And anxiety takes that away, and we try and work to make sure they get that back. And one of the things we know is if kids don't get help with anxiety, it leads to problems later on. So they often have fear of friends, more difficulty with new situations or engaging with new kids or joining things. And it can affect school. So they avoid school, but it can also decrease confidence in school and cause problems academically. And in the long term, and there's very good epidemiological studies where they follow populations of people who have anxiety who don't get help, it changes their outcomes. So it changes how you look at post-secondary education and what you do. It changes job opportunities. It changes relationship opportunities because how you feel about yourself and your capabilities makes a big difference in the choices you make. And it also is an increased risk of other mental health problems, so depression and substance use disorders being two of the more common. So depression, comorbid in teens, is quite common. Severe anxiety if it's not treated, and substance use because a lot of people start to self-medicate to try and manage the anxiety. It's a form of avoidance. It actually does decrease anxiety a bit. It's just not very helpful because in the brain it actually harms the brain and the brain chemistry and actually makes anxiety and mood worse in the long run, but in the moment it can actually dull some of that fear and anxiety. So looking for something that at least will help allay that anxiety in that moment. And one of the things we talk about is, how can we do anxiety treatment in groups? Because in young kids we do groups together. In teens we sometimes do groups, but we do individual work as well. And all kids are different. So it's not like anyone's anxiety is the same, nor is what drives it necessarily the same, but actually how you approach it is the same. So we focus on how they think, how they act, and the strategies around relaxing their body, coping. All those strategies are the same, and then we help them tailor it to what their worries and fears and how their behaviors are. So they work on their own skills about their fears, but the basic skills are the same, and that's why we're able to do sometimes that in groups. And one of the great things about groups, if you have young kids and you do the groups, is you meet other parents who have kids with anxiety. So you get a lot of support from that, and kids meet other kids with anxiety. A lot of kids feel like they're the only one. It's a very quiet illness that many people don't talk about. And so meeting other people with anxiety and knowing that you're not alone, and actually one of the things we see in groups is kids actually encouraging others to face their fears and then cheering them on. Because it's a lot of hard work to fight anxiety, especially at the beginning, and having that encouragement and support is really helpful. And I talked about what an anxiety disorder is before, so if it causes distress, interferes in your function, too extreme for the situation. So now I'm going to talk about the different types of anxiety disorders, just like a brief overview. Separation anxiety disorder is probably the most common anxiety disorder in younger kids. Usually 6 to 12 is the most common age range for it, and it's the one we talked about when you're really worried about something bad happening to you or your caregiver if you're separated, and you will do anything in your power to prevent that separation. So these kids will have trouble sleeping on their own. You would have a lot of trouble leaving them with a babysitter at night, usually, unless it's a close family member that they're very comfortable with. They have a lot of trouble with sleepovers, going away on school trips without a parent there, and sometimes a lot of trouble attending school when they're separated. And in extreme situations, not even being able to be in a different room in the house, so needing to be in eyesight of a parent or caregiver anytime they're in the house, and not even be able to be on a different floor or a different room. So that becomes a very avoidant pattern and high distress in a home because you don't get any breaks. And so really needs help with both parents and the kid in terms of how do they cope with the anxiety and start to gain confidence that they can manage it on their own in small steps. Generalized anxiety disorder, we talk about these kids as the great worriers, the fantastic worriers. You can say anything and they can worry about it. And these kids are often the ones that if you don't want to have news on, when they did have newspapers come to your home, they didn't want to have them reading the newspaper. Now on the internet, they see things, they worry about them, they ruminate on them. If you tell them about a medicine and medicine side effects, they'll start to worry, scan their body to see if they have any of those symptoms. They worry a lot about the future. They worry about performance, getting things right, getting in trouble. And also they worry about parents' health, finances, what I call adult worries. They worry more than they should. So they worry like an adult, and they're really a kid. And sometimes people have that kind of trend, but when it starts to interfere in their function, cause them a lot of stress, they actually stop enjoying things. They need a lot of reassurance. They get a lot of muscle tension and muscle aches with generalized anxiety disorder because they're feeling it all the time, that tension. So it can really start to interfere for them. Social phobia I talked about is the most common anxiety disorder in teens, and a lot of people equate that with shyness. It's totally different than shyness. So shyness is actually a very important trait that we need in our population. Introverts are very important as well as extroverts. The balance is it's only the only way the world will work. If we had all introverts, it probably wouldn't go so well. If we had all extroverts, it would definitely not go very well. So the balance is incredibly important. But social anxiety is really fear of humiliation, embarrassment in a social situation. And it's not just a little bit. For these youth who have it, they ruminate all day about one thing they said. They cannot let it go. How did that sound? They think I'm an idiot. Like, I can't believe I said that. And they will ruminate, beat themselves up to the point where they won't say anything or they won't engage socially. And we have teens who stop going to school completely because of social anxiety. And the risk of depression and substance use and social anxiety is quite high if it becomes severe. Specific phobia overall in the population is the most common anxiety disorder. It is a fear of a specific thing. We don't see it as often in treatment because most of the time people just avoid whatever it is they're really, really afraid of unless it really gets in the way of their functioning. So an example would be needle phobia. So kids who are really afraid of needles or injections around grade 7. Vaccinations, not being able to get those, that actually does interfere because they need to get those as part of their public health and healthcare. Kids who have needle phobia with diabetes, they need help with that. Kids who are afraid of storms, so that can actually mean that they don't go outdoors or bugs or insects to an extreme where they won't leave the house. So those are times where a specific phobia may get in the way, but a lot of times people just avoid what it is, like if it's heights, then they just don't go up on really tall things, and they manage it that way. So although it's the most common in the population, we don't see it as often in treatment. And panic disorder is one of the rarer ones. Panic attacks, which we talked about with the fight-flight response, can occur with any anxiety disorder, but panic disorder is out of the blue panic attacks, so not when you're in an anxious or fearful situation, but an out of the blue, can't predict, heart racing, can't catch your breath, feels like you're going to die. If you've had that experience, it is so incredibly scary. You will do just about anything to not have it again, or at least not to be alone or without someone close to you to help when you're in that situation. So after even one significant panic attack, kids can start to not want to leave home, or at least have a parent close to them being able to call if they feel any symptoms, wanting to come home because they're so afraid of having that again, particularly if your first panic attack is outside of the home when you have it, like in school. You're so worried about what others are going to say, what if something really does happen, who's going to help you, what are people going to think afterwards, because it's at a very extreme feeling when you have it. So a lot of kids really dread it afterwards, even if they're not having them frequently. So now I'm going to talk a little bit about treatment, which I can allude to, but just to go through this cartoon in case actually you can see it pretty well up there, but with my motion, I think it sounds better, so it goes. The fuel light's on, Frank. We're all going to die, we're all going to die! Wait, oh, my mistake, that's the intercom light. So your brain overreacting is causing this, and we've all had it. My big thing is I slept through my exam. That must be some geeky thing but like thinking that I missed the day of my exam and I'm just going. And the other thing now that I'm done exams is I forgot to put that it's actually I'm on call that night, and I didn't put it in my calendar correctly, and that actually the hospital's trying to reach me. So those are my two. I'm just full disclosure. But then I get into a panic and I need to go check and make sure that I'm not on call that night. But it is that thinking, you get really anxious about it, it sets off an alarm bell. It's only when your frontal lobe kicks back in and says, actually, that's the wrong light you're reacting to right now, or you've actually done what you needed to do, that you can actually calm that response down. And that's what we work on in therapy. When we talk about what causes anxiety, because everyone always asks that question, and one of the things that we become really good at in psychiatry and mental health is saying all the things that potentially cause it, which really means that we don't know what really causes anything, but trying to say it in a really smart way, so it sounds like we know what we're talking about, but actually we don't know what causes anxiety. That's the truth. It runs in families, so genetics is the number one thing in all mental health conditions that we know there is something that runs in families in terms of genetics, but it's not a gene. There's no anxiety gene. It is something that does get sometimes passed down in terms of risk for anxiety, is what we say. So we know kids who have parents who are anxious are more at risk of developing anxiety, but it's not a one-to-one. And we also know that kids of parents with anxiety who get treatment do very well. So it doesn't mean, oh, that's going to make a difference. It just means if you have very anxious parents who actually have an anxiety disorder and your kids start to show symptoms, it's a really good idea to get them some therapy strategies early, because it can make quite a difference for how they manage anxiety and how their brain develops along the way. But it's really a propensity or a risk for anxiety and not a specific type of anxiety that is passed down. The other things that can contribute, and parents do not cause anxiety, that is, I mean, they do make, your kids will tell you they've made you anxious, you've upset me, it's your fault. I mean, those are all normal things for your kids to say, hear it all the time. But there are ways that we react or respond or we handle anxiety that can affect how kids might behave in the same situation. So we do have influence on our kids, and I will say that even teenagers. So some people think we're done, like in terms of they're not listening to us anyway. They watch everything we do. So they might not seem like they're listening, but teens really watch everything. So how we model makes a big difference. How we react makes a big difference, and how we react to their anxiety makes a big difference. So if we handle it sort of calmly, that's your anxiety, these are the things we're going to do, or do we get really upset and distressed and angry and things kind of escalate? How do we handle a situation we're worried about? What if we get overreact, or do we actually acknowledge, wow, I really overreacted to that? You know, I didn't mean to take away Christmas, to go back to that story, which is true. But how do we react to these situations is really important, and how do we behave in situations, because kids watch very closely, a lot more than they actually listen to what we say. And traumatic life events, some kids have no anxiety symptoms, they seem pretty carefree, but they can have a stressful life event that actually leads to developing an anxiety disorder. So it can be a loss, it can be a significant transition or change in their life, and it can be a trauma. So there are things that can cause stress in a kid's life who may not have any anxiety symptoms and could develop an anxiety disorder. So what do we do to help? We teach people about anxiety, because understanding anxiety is the first part of therapy. It's really important. Otherwise, it's really hard to help if you don't understand what's driving anxiety. And I talked about the different types of treatment we have, but there's groups, individual, family therapy sometimes is helpful if there's communications patterns in a family that are causing a lot of stress and not allowing for people to start to have their own ability to cope with their own situations. So people who are sort of getting escalated themselves, so family therapy can actually be quite helpful. Medication can also be helpful, especially in moderate to severe anxiety, where the distress is so high that actually using the therapy strategies is too hard. Or the depression has also occurred with the anxiety, and it's actually making it too hard to even think properly and focus to do the therapy. Then sometimes the medication is needed as well. And then we always talk about how are you living. So what is helpful with decreasing stress and anxiety at an overall baseline is how well we're doing with our sleep, eating healthy, regular activity, and positive social interactions. They all help our brain to do better and cope with stress better. And we can all think of times where we're not getting enough sleep and how the smallest things start to cause more problems for us, and we don't cope as well, we get overwhelmed more. It would be the same as not eating regularly or not eating healthy. And for many people, physical activity, if you're used to using that and you're become injured or not able to do that, it actually can make quite a difference in your stress level and how you're coping. Some of the best evidence is, I will be truthful, around sleep and physical activity in terms of stress and anxiety management. We push eating healthy because it's a really important thing in your overall health. Probably not quite as tied to anxiety as the other two in terms of management, but it's always a good thing, so we make sure that we put it in there. We do know that if kids don't eat regularly and fuel their bodies properly, so they're taking mostly sugar foods, then they're more likely to have this emotionally, and they're not going to do as well with handling stress. And the positive social interactions is the brain actually releases endorphins and actually has a very positive chemical response in terms of decreasing stress with positive social interactions. The opposite would be true of negative social interactions. So we'll often talk to kids that they're in friendships that aren't that supportive or helpful or more on the negative side. It's actually increasing a lot of stress in their lives. And that the positive, and trying to get to recognize, as we do as adults as we go along, what are the really positive relationships in my life that I want to continue, because they're really helpful for your overall emotional well-being and how you manage stress. What are the ones possible I could not have so much interaction with that are causing a lot of stress in my life? Some of them aren't as manageable. They may be at work, and but how do you manage those, because they do make a big difference. So now it's break time, and I'm thinking we'll pause for a second and I can answer questions. The last part's shorter. Excellent. Okay, so that was a really long break, so you probably don't remember anything said. Just kidding. So just the 3 parts to worry: thinking, feeling, doing. Anxious children and teens, they will often think things are more dangerous than they really are, or actually when something isn't dangerous, they perceive danger. And that anxious kids often have a turbocharged, say, or supercharged fright flight. So they have an over-response of their limbic system and amygdala in terms of a fright flight response to a situation. And we need to help them to activate their frontal lobe and calm that down, and then not overreact, so not have their brain triggered so easily. And they often behave in ways where they avoid a situation, get overly distressed by it, and seek a lot of reassurance around their anxiety. And those things can actually make the anxiety worse. So the next part is unhelpful and unhelpful ways to manage. We start with the unhelpful, and then we move into the helpful ways. And the truth is that we will all do unhelpful things at times as parents, and that's okay. We want to just try and get more of the time being helpful than unhelpful, but there are going to be times we do unhelpful things as parents, because we are human and we can only do so much, and we also have our own stresses and things that go on. So we'll talk about thinking about what your current strategies are that you're using in terms of helping your kids with anxiety, and then kind of comparing them to these unhelpful and helpful ways. So one of the unhelpful ways is excessively reassuring around anxiety. So because it's a normal response for us when our kids are worried or when our kids need something, we can get into a pattern and not even realize how much we reassure until we actually were to look at it in a day. And so one example would be, having a nighttime routine is good. But if you're into a 20-minute good night routine and it has to all be the exact same way every night, it's probably getting a little rigid, like where, or it's starting to grow. So thinking about how much, you are reassuring or needing to do things to make sure that everything's all right or nothing bad will happen. And then thinking about maybe how do you back off from that, and that has to be gradual. So if you're in a really big reassurance routine, you can't go cold turkey, not reassuring you anymore. That's reassuring. We actually talk about that's your anxiety, and we know the reassurance will actually make it a little bit worse because you lose confidence in handling it. So from now on, when you ask that question, I'm going to answer it once, and then we'll write it down, the answer, and then you can look at it on the card. Or something where they can still reassure themselves, but you're not the one verbally. And if you can get them to the point where they actually can say it themselves, the reassurance, it actually makes a difference. So there's a difference between you receiving a message verbally and you actually saying it out loud in your brain. It actually changes how you respond and emotionally feel. So it's more important for them to be able to say it themselves than for you to keep saying the same thing over again, even though it's the exact same words. It's different. So we know that you'll never be able to give enough reassurance. I told you that before, and that you need to be able to help them be able to reassure and cope themselves. And one of the things we'll talk about is labeling that it's their anxiety, their worry, their fear, and that the reassurance is actually going to make it worse in the long run. So how do you guys work together to help decrease that and help them cope in other ways? Another unhelpful way, and we get trapped in this as parents with anxious kids, it just being too directive, because they either can't make a decision, they have a lot of trouble with being able to cope with the situation, and we actually start to tell them what to do. And to the point where they actually aren't making their own decisions anymore, feel like they can, so they need to ask us for that support at all times, and they lose that sort of independence and ability to cope on their own. So if you're doing a lot of things for your child because they're anxious, then their anxiety is going to get worse with that, because they won't be able to cope without you. And we want our kids to become more independent, not more dependent on us, because that will become quite overwhelming, and we won't be able to manage that in the long run. So we talk about increasing their self-confidence, decreasing their avoidance, and trying to get them to do some of these small steps on their own. And avoidance is another thing. So permitting or encouraging avoidance. So even though we know that you can't nag all the time or bug your kids to do things, you also don't want to have them avoid things consistently or participate in them avoiding things that actually they're anxious about, because it will actually snowball. So if they're starting to refuse to go to school and that continues, we know that after so many days it gets harder and harder to return to school. And the only way to actually know that the threat or your worry isn't real, or that your brain's over-exaggerating, is to actually do that activity and try it. And realize that actually my anxiety goes down. So for kids who are anxious about school or feeling sick to their stomach, we'll often see this pattern of Saturday's pretty good, Sunday they start to feel unwell, stomach aches, headaches, they wake up Monday morning and they're very unwell, feeling very unwell. But if they can get to school, then during the day, often those symptoms will start, and they'll kind of forget. Then the next day they may have those symptoms again, but over time, if that continues, they will get into kind of realizing actually those symptoms do get better when they're in school, and it gets easier and easier to attend. For some kids, they have sort of what I'd say sort of kind of butterflies, not feeling great at school for quite a long time. But we know that if they don't go at all, it becomes really, really hard for them to return. So sometimes it isn't quick when they're not avoiding for those symptoms to go away, but it's really important that they keep going. This is our anxiety avoidance behavior curve, and it's a good example. I'm going to get you to follow through. So we're going to do a situation where you're really afraid of water. So being really afraid of water, you do not want to even get your skin or your toes even touching it. So start with the worry scale, which we often talk about in therapy, but how high your worry is thinking about this situation. So start off here, we are going to the water today, so you're on the yellow curve. Your worry scale's 5 out of 10 or 50 out of 100. You start to drive towards the water, you see it, and your anxiety's up near the peak, and it stays very, very high. You put your feet into the water, that's sort of the low, like the end of the high part, and then as you keep your feet in the water, it actually starts to finally go down. However, if a well-meaning lifeguard comes over and rescues you and your feet from the water at the high point because you're screaming, "Get me out of the water," then the next time you come up, you will actually be on a higher yellow curve. So the next one will be more worry, more concern, longer time at a high level, and take a lot longer to extinguish. If you go on the green curve and you keep going and you actually practice and your anxiety goes down, you'll then follow the red curve, it'll go down, and it's very gradual. We call it habituation, but your anxiety gradually decreases. And this is what we work on a lot in therapy, in the behavioral part, is exposure to the situation you're fearful of, and then having your anxiety go down or decrease. Maybe not all the way to zero, but that you at least feel that panic feelings start to go down and gain confidence you can handle it. And it is not usually one practice. It's usually practicing it over time. So if it's avoiding school, you may be doing weeks of going, and maybe going even for half days, just to start to feel like less high distress when you're there, but gradually it will go down. It is how your brain works with exposure, and it will work over time. Some people take longer to have that sort of high panic extinguished than others. But that's a key component of therapy, and that is the behavioral part of the therapy, or the core part of the behavioral therapy. The other unhelpful way is becoming impatient. I don't know if anyone ever becomes impatient with their kids. It almost never happens to me after a hard day at work. But one of the things we know is that parenting is hard work. It's even harder if you have a child or teen with anxiety, and it can be incredibly frustrating. And that we will get frustrated or angry at times. And it's important to try and moderate that, take breaks. When you do lose your temper, come back and say, I'm not really mad at you, I'm mad at the situation, I'm mad that anxiety is taking this away from you, this is something you should be able to have, and I'm really upset by that. And being able to, what we talk about is externalizing the anxiety, so instead of being mad at them or being mad at the sport, or instead saying, I'm really mad at anxiety right now. I'm mad about how it's taken, your friends away, school away, how it's making you hard for you to sleep on your own, whatever it is that it's really interfering. Or, I'm mad that it's causing you to be really irritable and hard to have fun with at home because you're always cranky and angry at people. And I'm really mad about anxiety because if it wasn't there, we would be able to have a lot of fun as a family, and anxiety really interferes with that. So those are the ways to, I really think when we talk to kids and families, it is really important to externalize that that's what you're upset about. And when you lose your temper, it's the anxiety that is really frustrating you and the behaviors that maybe anxiety causes, but it's not them. It's not, and that it does really help diffuse it to be able to do that. So it's one of the key strategies in sort of helping your kids, but also when you apologize that you're really frustrated by the anxiety, and it is really frustrating. And usually your kid's really frustrated by it too, even if they don't fully recognize it. The things that we get frustrated by are the repetitive reassurance, when we finally just get totally frustrated and we're not going to answer another question, or when they can't do something that you really feel and know they should be able to, or they used to be able to, or you really just wish they didn't have to miss out on it. Whether it's an activity that they would really enjoy and you know it, or a party, and that they just can't do it. And you feel like they should be able to if they tried harder, but the anxiety is getting in the way of them being able to do it. So now we get into helpful ways. One of the biggest things is to fight anxiety is a ton of work, and it's not really fair if you have anxiety that interferes in your life, because no one else has to work as hard at some of these things as you do. So we talk about rewarding people, rewarding kids, rewarding teens when they do fight their anxiety, even if it's effort and it's not fully successful. Rewarding effort is very important. So when we know they've tried really hard, even if it didn't work that time in terms of being successful, we would reward. As long as we know the effort is there, because more effort, more time, it will eventually become successful. And if they're being brave in a situation, or you catch them being brave, to really acknowledge that, how proud you are of them, because sometimes those times we miss, and we only see the times when they aren't, but there are times when kids really do fight their anxiety, and it's really important to recognize that. And we will say, you were really brave, or you did a good job fighting your anxiety or fighting your fear, whatever the words are you use in your house, because that will make them feel better about themselves, and it's all about building their confidence. The other is, when you can, if it's possible, if it's a behavior that is related to the anxiety but is something you can ignore, to do so. And that's particularly in younger kids, but it can happen in teens as well, where there might be a tantrum or anger around a situation that they are anxious about, they feel like they can't do, but they've been pushed, or and they get disrespectful or something. You have your own rules in your house, but if there is something that can be ignored and come back to later, that can be really helpful. The other is physical complaints. So if you know this is a pattern, stomach aches and headaches, spending a lot of time talking about it or checking in the morning, do you have a stomach ache, how's your head feeling, is not going to be helpful. And when they bring up the stomach aches and headaches, it's moving to the next step. Yep, that's your anxiety, and do you have your bag packed? Your lunch is on the counter, and just keep on the next steps. It's not to say you don't acknowledge, but that's not going to derail the plan. And so it is ignoring and not getting into, well, where does it hurt? Is it over here? So just continuing on, acknowledging, yes, you heard them, but you're continuing with this. The other would be reassurance seeking. So if you've already said, I'm going to reassure, like I will tell you once that, and then we'll have it, the card can really help, having it written down, because then you're not, read the card, you could say, have you, we did write it down, but I'm not going to say it again because we've already talked about this and it's anxiety, and then you get to the point where if you can ignore it totally afterwards, and tell them that's what you're going to do. So one of the big things about reassurance seeking and ignoring is letting your kids know that you're actually going to be doing this strategy beforehand, because if you come in with all these great tools and strategies and kind of surprise them with them, they usually do not work very well, because they're like, oh, you probably can't hear me, so let me just say it again louder. Maybe I need to come around you, maybe I need to, like they're very, I'm just going to knock on your door, I'm going to come into your room, like they will be very persistent. So it's really picking one or two to try, and usually I say one, and telling them about it beforehand. So I usually say start with something positive, like I'm going to start with noticing when they do something brave and when they really put a good effort forward around fighting it, and starting there. And then move into, okay, I'm going to try and decrease the reassurance thing, and we're going to talk about that and say, okay, we're going to try and decrease how many times you ask a question and I say the same thing. What do you think is a good goal? Like right now you're hitting about 10 times before. I was thinking 5. So at 5 I'm going to say that's 5 times. And then we're going to move on to something else. So you'll know I'm going to do it. And I'm actually, and then you can say, if they're still sort of pushing out, you can say, and when I'm ignoring you after that, it's because I want you to manage that on your own anxiety. And we'll check in, a couple hours later and see how that went. At first, they will persist. Anxiety is like glue, like it just wants to persist and keep binding you. So you want to have the conversation before these. You never work as surprises. And the other thing is, if there's something that they're doing that you really think is inappropriate and they need to stop, really identify what it is. So saying, if you're, that was very disrespectful what you said when you swore, for instance, then I'm not going to respond until you can change your tone, change your volume, change your language, and really sticking to that, because anxiety usually gets worse if you escalate it. So if you are responding, it's like any emotion, and you continue to have sort of a audience around swearing or anger or being disrespectful or rude, and that gets a lot of audience and a lot of interaction, then that can actually escalate it, because it becomes a way of sort of an outlet, but it's not a healthy outlet. So being able to say, you know what, that's a very disrespectful tone, I'm going to remove myself, but I'm glad to talk to you when things are calmer, or swearing isn't acceptable, I know you're anxious right now, glad to, so trying to get them to be reasonable. Once again, at first will not work and sometimes escalates behaviors and responses, but if you stick to it, it actually does start to work, because you're not going to engage around that, and you're not going to get in a big screaming match with them around it, because it's just going to make anxiety worse. And when they do well, even if you want to talk about what horrible thing they said to you before, if you can stop yourself, if they do calm themselves down, if they manage to regroup, if they come back and they're reasonable, to start with, you did a really good job calming down. I'm very proud of that. You can talk about behaviors later, but don't start with that, because it'll just go right back. So instead, start with when they do calm down, or if they do regroup, to be able to praise that. It's not praising, I'm really glad you said that horrible word to me. It's actually, you did regulate yourself. And that's a big skill, and it's not easy, and it's not easy for kids and teens often when they're really anxious. So. And then one of the main ones is preventing avoidance. So doing whatever you can to help them cope in a situation and not avoid. Even if it's a small step in the situation that they're avoiding, so maybe they can't do the whole thing, but is there one small step they could do in what they're afraid of that would actually still be moving towards facing their fear? So for instance, someone who really is afraid of taking the bus would be an example. Is there a way they could take the bus for a stop, or take the bus with you in the public bus and get used to it, or practicing different steps, maybe not the whole thing. For some people, they can't do, it's too anxiety provoking to think, okay, so starting tomorrow you're going to take the bus every day. Another example would be you haven't been in school in a week or 2 weeks. It might be too much to think about going back full. Too much anxiety. Is there a way that you could start to do, like work with the school to do a class or a half day or till recess? And do that for a few days or a week or more until you start to feel good about that, and then move on to the next step. All the lights on, turning one off. With sleeping, we often will do, instead of thinking, okay, for some kids they can actually, with rewards, start to fall asleep on their own and be in their own room. For others, we have a mattress that they actually, the parent has, and they move from the bed to the mattress and they sleep right beside, and that might be like a week, a month. Make sure you get a good comfortable mattress because you might be on it for a bit, and then we actually move the mattress. So we move the mattress out of the room gradually. Not all houses can do that, but that is something we've done. So there's different steps we will do. We'll also do different amounts of time the parent stays in the room in the bed. So we don't always go cold turkey. Sometimes we do small steps and with clear rewards. So it's like, what is the next step you could take to face your fear, be more independent? So those are things that we try and do so that they don't avoid fully, because even just doing one step, even if it's not full exposure, fully doing what they need to do, it is a big thing to, I guess, help the anxiety so that it doesn't take over completely. And the last part is really about the coping behaviors. So making sure you identify when they're worried and when they're complaining of physical complaints or when they're avoiding that it's anxiety. Sometimes we forget to do that. We think that they know, but it's really important because they may not recognize sometimes that it's their anxiety that's getting in the way. And that really helps them in learning to fight it and also recognizing how it's interfering in their life so it becomes more motivating to fight it. And then helping them with coping with it. You can handle this. You've done this before, what's the next step you can take a deep breath. In our therapy strategies, but also on the Anxiety BC website, kids learn relaxation strategies, deep breathing, ways to kind of calm their body in the moment, at night, or other times so that they actually can handle these situations and face their fear. And I talked about the small steps, so it is really important, just like there's always the story of the person that learned to swim by being thrown into the deep end. There's many more stories of that, of the person that never wants to go in the water again after someone tried to teach them to swim by throwing them in the deep end. So we say one step at a time, small steps, and you want to be successful in those steps. If the first step you take doesn't work out, it's too hard, even though you put good effort for it, we change the step, and that's part of what we do in therapy. So if it's too hard to go to school, you've been out of school for a while, we'll go visit the school on the weekend. We have schools in the summer that will, like at the last few weeks, they'll let kids come visit, go to their classroom, see their classroom for kids who are really anxious around transition, especially going to a new school, and they'll spend a couple of days, even a full week, just visiting the school the week before all the kids come back. So there's lots of ways to take some steps without having to go what I call flooding or full in. And when kids are afraid of something, we often don't want to put them right in. So an example would be with animals. Dogs would be a common fear of some kids. Well, bring it, saying, okay, so we're going to bring you to the pet store and you're going to handle like 5 different dogs is often not the first step. That's kind of flooding. And for some kids, they're really afraid. So it might actually be watching a movie about dogs or watching a video about dogs and then actually being on the other side of the street from a dog or the other side of a cage from a dog and just sitting there and feeling and getting themselves calm in that situation before we get them into a situation where like, pat the dog, nice dog, because they actually get more anxious around that and it usually doesn't give them a chance to start to feel confident they can handle it. With kids with social anxiety, we have a great story. When we used to have a clinic on Spring Garden Road, and one of the things we did with the teen groups is we would be doing exposures, and we do actually with kids and teens groups, we do the exposures in session so they get practice of facing a fear during the session so they get confident they can actually do it when they leave. And one of the big things about social anxiety is you're really afraid of asking a question of someone and what they're going to say. So near the end of our 10-week session, one of the big tasks for kids with social anxiety was to stand under the public garden sign, that's where we were close to, and ask people where the public gardens was. Because it's a little extreme, people laugh at you because you're right, so, but you have those, for those kids, they realize, okay, well, the world didn't fall apart, this was a stranger, so it's pretty safe because someone they're not going to see again. But the world didn't fall apart when someone laughed at me, and I actually could handle it when someone laughed at me. And it is kind of funny, right? So it's those, we kind of would set them up. We'd also do the, what time is it? And they'd have to look at their watch. They'd have to ask a question in a store, that obviously didn't sell what they were going to ask for, and they had to ask for that item anyway. And just to practice the, either being rejected and saying, we don't sell that. And we couldn't prompt some of the storekeepers, so they would get whatever, and then they had to sort of deal with that, of the response of others and how they coped with it. And then people saying, but you did a really good job. Yeah, he was a jerk to you, but you did a really good job handling it, and that's going to happen in real life. So we do a lot of small steps in supporting them, but we do a lot of what we call in-session exposures, where we get them to practice on things. And it's things that you can do also for your kid. Well, how would you try out that step? What would you actually do? And then how do you reward yourself afterwards? Because it's hard. It's hard work to fight anxiety, but the more you do it, the easier it gets. And then what we do. And so thinking about how we handle anxious situations and how we respond, and really reflecting on that when we're doing different things, so that our kids can learn from that, and also we can model that as well. So for some of us, we do see the world as a fearful, dangerous place. So we need to think about how we might be transmitting that to our kids, and how do we do that in a way that actually doesn't make them already have to perceive the world that we do. So what we do know with anxiety is there are some cognitive, thinking biases that people have, and they might see things, they see in neutral situations, they might see risk where people who don't have anxiety see it as a neutral situation or even a positive. And so how do we help them with some of those biases that might be there in terms of reassessing? Okay, well, I know that I often see things as a little bit more on the negative side, more on the fearful, so how do I balance that? And being able to reflect and say, okay, so I know I do that, that's kind of a pattern for me, and I know the next thing I need to do is make sure that I calm myself down, and I actually don't avoid what it is, and I can actually do this, and that self-talk is really important. So showing that ourselves is really important. And this is my favorite Morgan Freeman quote, and I said it a lot at the beginning, but it's absolutely true, and I can tell you the teams that I work with, they very rarely say, I remember when you said that, but they will tell me everything I've done. Like, they watch everything I do, how I do it, and so they'll say, but I saw when you did that, or I watched you on TV and you did this, and you looked really anxious when that interviewer asked you that question. Like, they really watch your body language, and they're right on. And I said, well, I was really anxious. And I said, that was a good pickup, about how you noticed that in my body language. I said, how do you think I did? And they said, well, you did okay. I wouldn't have answered it quite that way. But they really do watch how we behave and what we do, even more than what we say. So it is really important. So we're gonna, the last part is some test scenarios, just to see how much you're paying attention. They're not very testy, they're quite. So it's really to sort of give a situation and then sort of get you guys to reflect on them. I'm going to not have you guys participate fully in this one. I'm going to kind of tell you the situation, and then we'll go through the questions and I'll kind of answer them. And then the last part is just some tips around sleep and exercise. So the test scenario one is, kid says, please don't leave me here with a stranger. You never take me anywhere. If you really love me, you'd stay back here with me. Now you know I love you. I just need some time for myself. It's not that you're not important and I'll only be away for a little while. In fact, if you stop fussing, I'll come back early and I'll buy you a pony. No, I'm just so this situation, in this situation, what's happening? So what I think of as happening here is, the child doesn't want to be separated from the parent. They're highly anxious about it, and we don't want to see our kids distressed. So we get into a situation like, oh my gosh, they're really upset. So one example of this that I did in terms of modeling was when I first took my son to preschool, and I do anxiety work. If you read my script, my words looked perfect. It was, this is going to be a great day for you. I'm really proud of you. You're going to love your teacher. But my voice was, this is going to be a great day for you. I'm really proud of you. Mommy's so proud of you. This is going to be awesome. I'm going to be back before you know it. But my voice was really not so calm. And by the end, when I left, he was plastered on the preschool window, sobbing. And the preschool teacher who knew me and knows what I do called me afterwards and said, that might be the worst goodbye I've seen in my career, and she's been a preschool teacher for a long time. But it is really, so we get into this, like he looked a little distressed, then I was distressed, then my voice was distressed, and he immediately picked up on that, and then it was all over. So really important to make sure that we manage our own, okay, this is actually a good situation, this is good, they're in a safe place, and we're not going to change our patterns or behaviors around that, and we're going to help them to cope with it, and we're going to tell them, we're going to be back, but we're not going to get into a lot of reassurance. This is scenario 2. I feel really sick, my head hurts, I can't go to school today. Don't you have a big presentation today? Yeah, but I'm really sick. The teacher will understand and I can reschedule. Well, if you're really sick and there's nothing else to do, I'll call the school and let them know. Do you want to watch TV? Obviously extreme, but one of the things that we know is that avoidance often leads to, if you're home, doing things that have some secondary gain, like electronics and other things, which are quite rewarding and also great distractions from whatever it is, but they keep you from doing the things you need to do. So if in this situation, there's physical symptoms of anxiety, it's a clear stressor, but we want to see if we can get them to go, because the next time there's a presentation or a task or a thing, that pattern will already be there. So it's just trying to get them to say, yeah, that sounds like your anxiety, and we know presentations cause some anxiety, but you really practiced, or hopefully they have, and so have a great day, and then talk about maybe what you're going to do after school together, or what you could do to kind of reward them after the day. So those kind of things are really important, instead of, yeah, you're right, this is going to be really, you probably are sick. Now, I always have parents who tell me the story of when they did send their kids and they actually had a roaring fever by noon and are vomiting. So will we get it right every time? No, but you do get a good sense if you have an anxious kid of whether they're really ill or whether it's anxiety. Not because they don't feel the symptoms, but you look different. You usually don't have a fever. If it's anxiety, you're usually not profusely vomiting if it's anxiety. So some people get nauseous with anxiety, but they're usually not projectile vomiting. So, I usually say high fever, projectile vomiting. Even with anxiety, you probably got the flu and you probably should rest. But stomach aches, headaches in a stressful situation, most of us have to go to work with those things anyway. So they're things that they can manage when they're at school, and often they get better once they're there. Diet, exercise, sleep is the last part, just in terms of helpful strategies. One of the big things is electronics with sleep. Most kids have a device of some sort, but you would not believe that the numbers that sleep with multiple devices. And so if your kid is a great sleeper, never has problems, is managing well and not overly stressed, then possibly they're managing that well. But for most kids, they're highly addictive. There's tons of social information in there. They're afraid of missing things, and they can't self-regulate around those at night. So if there's a way to start a pattern where you actually take them at night so that their sleep is uninterrupted, that can be a really helpful thing. As they get older, it's harder, but starting in the younger years is a really good idea. And the lights from the phone for kids who have trouble sleeping can actually make it hard to fall asleep as well, the light that's emitted. So not just night lights that you can have, but actually the screen emission. So if there's a way to kind of have those devices gone, many people will say the only reason I'm on my device or the only reason I'm watching that is because I can't sleep. And I say, something else? No. These things actually keep you up. There's good evidence around it. And actually your brain can't fall asleep when you're on them. So you will definitely stay up later. And any of us who are actually on devices at night will know that if we are reading a book, our ability to fall asleep is actually pretty on a regular part. But if we're watching a movie or something on Netflix, and I will talk from some, we will watch till the end, or we will watch into the next one. We'll watch till we're much tireder than we would if we were on a book. So we do not regulate our sleep as well on device. It's very well known, very well shown, and that's because our brains are stimulated with those things. So we have to be a lot more tired before we fall asleep, let alone with video games. So it is something to be aware of and to try and raise, especially for kids who have trouble sleeping, because sleep is our key brain health strategy. Without enough sleep, our brains do not work well and they don't handle stress as well. And that is for every human being. Some people don't need as much sleep, but everyone needs sleep, and we all know that people can't survive without enough sleep in the long run. So you can see sleep is bold, just in case you didn't know how important it was. And diet. So one of the only real diet link for anxiety that we know of clearly is caffeine. And it doesn't cause anxiety disorders, but it increases your heart rate. It can cause cardiovascular kind of stimulation, and so in that way it can increase anxiety. So we know kids who eat a lot of caffeine and cola drinks can have some increased anxiety symptoms. But there's really no evidence of other things, although there are pockets of evidence. Some kids have more reaction with allergies, so some kids are quite sensitive to certain medicines. Kids who have gluten sensitivities or allergies to certain dyes, it can actually worsen their anxiety symptoms. So there are pockets of kids, but in the general population, gluten doesn't cause that. Red dye doesn't cause it, but there are some people that are more sensitive. So when someone said, is that possible that red dye is causing things to be worse for him? Yeah. If you see a pattern in your kids and you can take it out and see if it makes a difference, it's worth it. Some people it's lactose. We know that some kids are very intolerant of lactose, and it actually can make a big change in their behavior when it is removed, as long as they still are getting the nutrients they need. So it never happens, but in the general population, there's not any one other dietary product that actually causes anxiety. One of the things that we do know is that anxious kids will sometimes eat to soothe themselves, and that is not a good long-term coping strategy, and they need to learn other strategies because it can have serious health risks. And obesity is one of the big risks in children because their health risks long-term are much more significant around diabetes and cardiovascular disease. So we don't want people to get in the habit of that is how they self-soothe and manage anxiety. We want them to have other healthy ways to cope. I talked about exercise. One of the big things about exercise is how do you build it in for kids who aren't exercising? And it would be even as simple as we talk about kids being either walking to a different bus stop, getting off on a bus stop earlier, if they're getting a drive home, being dropped off at a corner, building and walking. It doesn't always have to be a sport. It could be walking a pet. It could be doing something physical in the house. But the actual effort of actually doing something that increases your heart rate a bit, even for 15 to 20 minutes. Sometimes people say, well, if I'm not going to do 60 minutes 5 times a week like the Canadian guidelines say, then why bother at all? Because it says you have to do at least that. Well, no. If you're doing just one step, say you do 20 minutes 3 times a week as a start, that can make a difference. And you build from there. Sometimes people just put unreasonable expectations in physical activity, and then you just don't want to start because you're not taking small steps. You're trying to do this giant leap. So thinking about that for your kids, what could you build in that's physically active? And it doesn't necessarily have to be something that's like playing basketball. And martial arts are very physically active. Yoga can be very helpful. Biking, walking, so there's lots of different ways to think about it, and if your kids having a lot of trouble doing things as a family can make a big difference too on the weekends, so thinking of ways to build in exercise. One of the things we know for kids who have trouble exercising, that if their family's exercising, that has a huge influence on whether they will start to exercise. So we sometimes expect things from our kids when we're not doing it ourselves, so having that modeled within the home makes a big difference. And then sleep. So this is very important in terms of, particularly for kids who worry about sleep, who have a lot of trouble falling asleep, setting up a regular routine around sleep, not allowing kids to have naps, even 20 to 30-minute naps. Some people do naps and no problem, they fall asleep well at night, but naps can really interfere. Even a 20-minute nap can really interfere with someone's ability to fall asleep if they're not a good sleeper. So discouraging napping. Physical activity, obviously very important, not right at bedtime, but within 2 hours, as long as it's finished within 2 hours of bedtime. Obviously not caffeine, we usually say from noon on, but at least from afternoon on. And then trying not to have highly stimulating things in the bedroom. The other thing that some kids who are really worried, they worry a lot about bed and they clock watch. And they worry that what time it is, I'm not going to get enough sleep, I'm going to be tired tomorrow, I'm not going to be able to do well. So we really try and work on removing those things that check, because your brain will get enough sleep if you allow it. So if you don't have something overstimulating, you don't have something you're worried and you're checking, your brain will allow you to get enough sleep as you practice. It's a skill. Sleeping's a skill, and some people have to work harder at it than others, but it's having a routine. And to change your sleep routine, if it's not good, it takes in the weeks to months. It's not a 3-day thing. So you have to really work on it. So when kids are getting ready to go back to school and their sleep cycle's completely reversed, I'm talking about 2 weeks before school starts, because they're a really hard thing to change overnight. And removing things that are noisy in the room. So really finding out, one youth was having lunch, we'd removed everything, and then they said, do you think it could be the pets in his room? And I'm like, yes, pets in his room? I'd never heard, I don't think they have any cats or dogs, but they had lizards, and the lizards are up at night, and then there were crickets. So I'm like, yeah, I think those could be contributing. I think that might be contributing. So knowing what's in the room, and if there's anything noisy that's distracting, especially for light sleepers, to remove it. So this is the end. It's just remembering that fear and anxiety is normal and to be expected, and so we worry about the fears and anxiety that get in the way of your functioning or cause a lot of distress, but we don't want to get rid of all anxiety and fear, because it's a normal developmental stage and it does keep us safe and helps us make good decisions. And the last part is questions. So that'll be the end of our talk.